Good evening, everyone. I'd like to call to order the Community Mental Health Board meeting for Wednesday, April 23rd, 2025. Please rise for the pledge. Next, we will have the reading of the mission statement from Lori.
Macomb County Community Mental Health, guided by the values, strengths, and the informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next item is adoption of the agenda. I'll take a motion to adopt. Motion from, it's my first meeting back after a while. Give me a break. Motion from Antoinette, support from Lori. Comments, questions on the agenda? Changes? Okay, seeing none, all in favor, say aye. Aye. All opposed? The agenda is adopted. Next, we'll have hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. Come up to the podium. Give us your name and whatever you want to talk about. Anybody from the public? Next, not public. All right, we'll close the first hearing of the public. We will have one more before the end of the meeting. And we'll move on to item 5, which is minutes. I'll take a motion to approve the minutes of the CMH full board meeting held on Wednesday, March 26th, 2025. Motion from Megan, support from Antoinette. Are there comments or changes, edits to those minutes? Seeing and hearing none. All in favor, say aye. 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 All opposed? Those minutes are adopted. Item 6, approval of standing committee meeting minutes. I will take a motion to approve the minutes of the CMH Program and Budget Committee meeting held on Wednesday, April 9th, 2025. Motion from Selena, support from Mark. Comments, questions, edits? Okay, seeing and hearing none. All in favor, say aye. 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 All opposed? Minutes are adopted. And now we'll move on to item 7, request to approve all of these items except one were discussed at length at program and budget. So I will take a motion to approve items 7A through H. Motion from Megan, support from Selena. Were there any further comments or questions on any of these items? Okay, hearing and seeing none. All in favor, say aye. 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 All opposed? Motion passes. Next, we'll move on to item 7I, which is a new item. I will take a motion to approve out-of-state travel for the rescheduled Clubhouse World Seminar in Florida, which will be 1 Clubhouse staff and 3 Clubhouse members at a total cost of no greater than $1,000. Motion from Donna, support from Selena. Bruce, let's try this again.
Yes, sir. Thank you, Mr. Chair. And welcome, Sharita and Julia, for joining the CMH board. This is a great opportunity for Crossroads Clubhouse to go down to St. Pete, Florida. As you know, this is a reschedule from last year. I'm really actually quite excited to report that 2 of our Clubhouse members will be providing some information and actually sharing a couple discussion points regarding member leadership and some of the great opportunities that clubhouses have to offer. So we'll be having 3 members go down and 1 staff person. I will not be the staff person this time. I wanted to allow another staff person to go down and enjoy that experience and then come back and share with the clubhouse of what they learned to strengthen our clubhouse. Everybody that's going down is going down on a grant, including the 1 staff person. So really our only expense for Amy to go down is for her flight down there and food reimbursement. Everything is being covered by 4 grants, 4 different grants. And so great opportunity, inexpensive for us to go. It allows us to be on a world stage and kind of talk about Clubhouse Michigan. There's 16 of the seminars is there's somebody from Clubhouse Michigan, one of the clubhouses in Michigan, that are presenting on some of those panels. So, and of those, we're presenting in 3 of those. And so it's just phenomenal opportunity for not only Clubhouse Michigan, but Crossroads Clubhouse specifically.
That's great. Thank you, Bruce. Are there any comments or questions for Bruce? Donna?
Just I wanted, I'm on the advisory committee for Crossroads Clubhouse. And I'm just going to use this opportunity to just brag about Clubhouse, any chance I get. So I just wanted to let Sharita and Julia know that I would like to encourage everyone on the board, but specifically the new members on the board, to go visit the Clubhouse. It is amazing. I mean, anytime anyone on the board gets a chance, please come and just visit the Clubhouse. We have like a lot of the members that are on the advisory committee now, and every month when I go, like tomorrow, we're having an employment dinner at the Clubhouse, so I'm sure Bruce would love for anyone to come. It's at between 4 and 6. I mean, it is an amazing place to visit. It's amazing to see how well run it is, and just it's just an amazing place to be. It just gives you a great feeling when you're there. So any chance I get to talk about Clubhouse, I'm going to do it. And so this gave me the opportunity. Thank you.
Thank you, Donna.
Any other comments or questions for Bruce? Thumbs up from Nick. Okay. We have a motion and support. All in favor, say aye. Aye. All opposed? Motion passes.
Thank you.
Thank you, Bruce. Next, we'll move on to item 8, receive and file. We have no items there. Next, after that is item 9, resolutions. We do have 3 of them. I'll take a motion to approve all 3 of them, and then I'll turn it over to Tracy. Support. Motion from Selena, support from Lori. Tracy, go ahead.
We last time spoke about Linda Bush. You all are well known to her, and I just wanted to again express our deepest appreciation for her almost 20 years of dedication to this board as first a CAC member, but then also for the board, but also held several board officer positions. So I'm sure you guys all would express the same, and I of course just wanted to offer another opportunity for anybody to acknowledge her if they so choose, but I do want to acknowledge that you guys said the great things about what she's done for us. And of course, we will reach out to her once she returns geographically to us and maybe celebrate her in the manner that she feels is appropriate. The second one we have, I want to make sure to do them in the right order. Forgive me. We have Dr. Verma. Dr. Verma, if you notice, was in some way, shape, or form associated with us for 46 years. I know. And we have another doctor that she was no longer with us when she passed, but we have another doctor that just hit 40 years with us. So the amazing news is they've been with us for 40 years. The concerning news is, I'm sure you all know, is that the healthcare professionals are aging at a faster rate than we have to replace them with qualified professionals. Dr. Verma, though, was in several programs. She worked in ACT when she left us, but prior to that, she also did one of our outpatient clinics. So we were very sad to hear that she had left with us. She left our organization about 1.5 years ago or so, but we still wanted to honor her due to her volume of dedication. The next person we have, actually, I have never had the pleasure of meeting. She did leave our organization 11 years ago, but we did hear about her passing, and she was a dedicated therapist for Macomb County Community Mental Health for 21 years. And upon hearing that, we, of course, wanted to acknowledge the dedication and the great work that she did. And her name, just to make sure I get it, is Sister Mary Plunkett. So anybody who might have had the pleasure of meeting her, she had an outstanding career with us, but then she also had an outstanding career in service after leaving our organization.
Donna.
I had the pleasure of working with Mary Plunkett in the outpatient clinics, and a lot of what was mentioned in the resolution is exactly. Mary was an outstanding therapist, but more importantly, she was an outstanding person. She was a nun at the same time, and a lot of people found that surprising. I certainly did when I found out she was a nun, because I hadn't known it for a while. when I knew her, and then I had found out. But she was unbelievably dedicated to the people that we served, and always a wonderful person. And I really enjoyed her. She was a friend, besides being a fellow therapist in the outpatient clinics. And she was a wonderful person, and I really appreciated the resolution. And I think it really paid a lot of attention to exactly the kind of person that she was. Thank you.
And we also announced it out to the team because, as you know, we've got a 60-year history. That's how long we've been around, 60 years. So it's a long-standing history, and there's been thousands of people at this point that have devoted themselves to the good that we do. And as you know, they certainly don't do it for the pay. They do it for the good that's relevant to the community. So when we hear about these, or if you hear about any, please share with them because we want to definitely honor them and their family to know that we appreciate the dedication that they've provided to our community.
Thank you, Tracy. Were there any other board members with comments? Like Tracy said, we'll try to bring Linda back for compliments and roasting. You know, we'll do all that fun stuff when she gets back in the state. Seeing no other comments, we have motion and support for all three. All in favor, say aye. Aye. All opposed? Motion passes. Thank you. Next, we'll move on to item 10, the voucher listings. I'll take a motion to pay the bills. Support. Motion from Mark, support from Lori. Comments, questions on the bills? Seeing and hearing none, all in favor, say aye. 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 All opposed? Bills are paid. Next item is the management report. We'll start with the CFO update with Ken and Tony.
All right, good evening. We're going to review the February financial reports. So those should be in your packet. We're going to go to page 2, the first graphs. Fairly uneventful month. There's a lot of consistency, which is a good thing. We know that there's some unknowns coming, but as we report through February, you're going to hear a lot of the same themes because things have been fairly consistent. If you look at the revenue, nothing unusual to report there. Our revenue and our eligibles are tracking, on plan, and again, no material change from previous months. If you go to page 3, no material change in any of these charts either. Our cash and investments remain at the same level. You can see our due to state and unearned lease, those liabilities haven't changed. The next time those will change is when we have our next settlement. But at the moment, those remain where they are. And again, our cash and investment, the only significant impact that we could expect is, as we're working through the ISF issue, whenever that gets resolved, there could be an impact on the balance. I'm just going to go ahead and, unless there are any questions, move to page 5, just talk a little bit about our summary here. If you look at the Medicaid, and I'm focusing on the 2025 actual column, so we're currently running about a $20 million surplus in Medicaid, and then just over $1 million in Healthy Michigan. If you look over to the right, on the expense line, you're going to see 12 million favorable and 3.3 million favorable. And as we talked about last month, we were looking at that on our actual to budget, and we had noted some of the service lines that we were running favorable to budget. We talked a little bit about that. So we're continuing to do some work to look a little bit deeper and understand that. What I want to report today, and just as a reminder, the areas that we're seeing a favorable variance is around licensed residential, skill building, and inpatient. And that's what we talked about the last time. Now, I did want to let you know that I looked at this to last year. So if we compared this to the same time last year, we are actually paying more. So it's really, we budgeted more in those areas. So there's a budget variance, but we actually, through this period, through February, we've paid more. So just to put this into numbers, on the licensed residential, we are actually, we're showing about a $1.2 million variance, but we're about $6 million more through this year than we were last year. Same with skill building. We made some adjustments in our CLS rate, so we expected to spend more, and we're spending more than we were last year, but we're not spending all that we budgeted through this period. And then the last area was inpatient. We're actually about 1.2 million more than we spent through this period last year, but still favorable to budget. All the other areas are fairly immaterial. Those are the three service areas that are most significant. The next thing we want to do is going to dig a little bit deeper in there and look at what's happening at the provider level. So within those buckets, where are we seeing some variances or maybe some changes that that might be notable when we get to the provider level? The only other areas around our direct staff, we have a favorable variance there, but it's due to, again, we budgeted for more direct staff than we currently have on staff, so we're going to see a favorable variance. So those are the items of note in the expense area, and like I said, we'll continue to look at that, and if there anything that we think is important to bring to the board, we will. So I'm going to pause there for a moment just to see any questions. Is that clear to the board?
And I'll just add to this page as well. I mean, at risk of sounding like a broken record, we've talked about before the CCBHC. We have 3 new CCBHCs coming on board. Working through contracting until that's done. There's going to be claims recons / payments back. They're going to have to bill us. There's a lot of system work that's going on, that kind of stuff. It's not reflected here. How that changes our expense numbers. It could change quite a bit. I think our CCBHC numbers in particular are surplus. If you look at the bottom 2 boxes, and those 2 surplus lines added together is about $2.7 million. I expect that number to go down quite a bit as we recon those back. Is it going to be a deficit? Hopefully not, but until those numbers shake out, it's hard to project. So I just wanted to highlight that on this page, and that those efforts are ongoing to work on that. So
Go ahead, Wayne. Wayne, can you turn your microphone on?
Okay.
Can you turn your microphone on?
Do that?
There you go.
There it's on. Now you turned it off. Just hit it once. Okay, hit it once. Okay, I'm done. Hold it down.
Yeah, once it turns red, you're on. Just talk loud.
Okay. On page 72, non-Medicaid, it says we have 1.931066. That's unfavorable.
yes. So this is one where, as a CCBHC program, we need to accept everybody and provide services. So the non-Medicaid portion of that is largely unfunded. You can see that top line there, that's CCBHC specific allocation. Last year we got, was it 350,000 or so? You can see our expense just through this period, which is less than half a year, is about $2 million. So the CCBHC program, when you have a surplus on the Medicaid side, you can't really use them, they're distinct, but at the end of the year, we can kind of combine them together, and the surplus on the Medicaid side covers this deficit here. Is kind of how the program is set up. So this isn't unexpected, but it is an issue that we've talked about for a long time. Our surpluses in CCBHC have been robust throughout the years, but we do advocate with the state to boost that allocation. This is a reminder, this is that $5 million that has not been adjusted since the initiation of the CCBHC, but we continue to add CCBHCs. So the pie is the same, there's more hands trying to get a slice, I guess I'll say. So
It's
that
5
help?
million divided by 31
Okay,
is what we get.
so we're gonna get less than last year.
Yes.
I would expect most would. So that's an ongoing advocacy issue.
Yeah, well, we're on that page 6, and ours, it might be page, 73 perhaps in your packet. Just finishing that off, when we look at the state general fund, and that ties back to the issue we were just talking about with the hit against general fund, and we know that we're monitoring that, and that's going to continue to be an area of focus for us. And Ken and others oversee a committee to watch that general fund spend. But
And if you look at the GF box, if you will, the state general fund, we've got 3 million, just over 3 million in revenue and about 3.4 million in expense. So that's actually pretty close. So we've done a lot. Christine's team from MCO to, limit those services if we have a wait list and those kind of things that we're doing. So this spend is actually tracking pretty well. It's that CCBHC non-Medicaid that's really drawing that out of there. So we continue to do that, really targeted efforts with getting people Medicaid, getting their apps in, redeterminations, sending out reports related to that. That not only helps them, that just helps people generally if they can get back on Medicaid. So there's efforts around that, and I think we're seeing that pay off, at least in that box there.
And then the last area was just the all other. And there too, we have a surplus, about 9 million. That's where our investment income comes in. We've had very favorable experience in our investments. We continue to work closely with the treasurer office to invest as many of our funds as we can and take advantage of those returns. So, I wasn't going to go through the rest of the detail because it's pretty much the same. Unless there are specific questions, we would be happy to answer.
Any questions for Tony and Kim?
I do have some general kind of updates here at the end, if I might. We had a covered CCBHC audits. We have at least 3 audits going on, somewhere between 3 and 10. I don't know.
Yeah.
It
feels like.
They pop up constantly, but the usual suspects, our financial statement audits going on, our compliance exam audit that's part of that, and then we have a CMS claims audit that's new, so we're working through that. But we'll share the results of those when we have them. I wouldn't expect that to be until the summer, as our financial results are reported with the county, and they're 12/31 year end.
Can I interject real quick?
Sure.
And then another audit that's about to take place, we have our annual Medicaid verification audit. So we just had our kickoff meeting with Jefferson Wells this week. So that work is going to be underway, and we'll report those results probably in October. We get our report in September, bring it to the board around the October timeframe.
We're also thinking that there may be a mid-year rate adjustment with the state. I have not heard any further details other than that they're looking at it. We submitted a bunch of reporting in the March timeframe to support that effort. And also hoping to hear about our CCBHC bonus by the end of April. So Wayne, to your question, that bonus, if we meet certain metrics, we can use that to cover that CCBHC deficit, but we don't know what that number is until they tell us. It's kind of, one year it was just, I think we were able to argue and actually get more. So we went from 2 million to 2.5. The next year it went down to 1 million. So we don't know what that is. I would be hesitant to project it in here because it depends largely on how everyone else does. So the state largely doesn't meet the measures, so then they reallocate the pot. So anyway, hoping to hear about that, and we'll certainly report back when we know, but those were kind of my other updates.
Thank you both. Any questions, comments? Okay, thank you. Now we'll move on to the CEO update with Tracy.
So I'm gonna do a Donna move and just take a minute to express. If you guys remember in what was that, January, they were like, we have Tony and Ken and all the whole finance team were like, we have all these reports that are due and they lost count. Well, now it moved right into audits. So I'm sure you guys know this, but not only do they have the regular ones, but it just seems like we just continue to get bombarded to where sometimes we start thinking it's a conspiracy theory a little bit, right? With like one after the other of ones that maybe haven't been used in the past. But I'm proud to say that not only they are on top of it, but we're pretty confident outside of, we always have growth opportunities, right? But outside of making sure it's on time or, legitimately getting an extension. So I just want to thank them because I think they thought February 28th was going to be like, or March 1st was going to be amazing, and it really hasn't been. So thank you. But I am going to remind you, all of you earlier today received the board report, just as a friendly reminder, especially for the new team, is it really is helpful if you read through that, because that's going to give you the details of the details. That allows us an opportunity to have more of a highlight and kind of open discussion during now, but really make sure you look at that, because that's where you're going to get a lot more of what I'm going to do. But I am going to highlight some specific items in there and some other items. So in that board report, I did expand and do some educational opportunities. There's a section there, we called it Education and Advocacy. So the purpose of that is to kind of highlight a particular program every month, kind of again, just to speed up time. We've done that and we'll still do that, where people come up and do presentations. But in front of you, you have this little, what we call rat card. This is also in your board report. I just wanted to take a minute to make sure you understand that one of our evidence-based program is the Parent-Child Interaction Therapy. Evidence-based program, in case you're not familiar with, is exactly what it says. Someone's looked at it and it's been proven to have a positive impact, and it has a very specific fidelity model to it to ensure that the program follows this successful model. This is one of them. We actually only have a few staff that are trained in it. We actually don't have large volumes of people that actually currently benefit from it, but we are looking at potentially expanding at it due to the positive impact that it's having. It's just time consuming and expensive to have the staff trained, but just wanted to make sure you knew that was that. And we'll continue to highlight both in this meeting and in the board report, just various programs and things in an effort to make sure you understand. The other part is advocacy. So if you didn't check it out yet, I did include a ton of the materials. I apologize ahead of time because it's a long one. The report is long and it has a lot of material in it. But if you could even read it, I don't know, right before you go to sleep, just to make yourself tired, like one a night or something, it would be appreciated. I do think there's a lot of good attachments in there that educate you about if Medicaid is cut, what does that mean, right? So I think that's a big ask. And I think getting an outside perspective on what that means, and I'm not suggesting that will happen, but there's a high likelihood, it might not be at a grand scale, but there's a high likelihood that we're gonna have less funding in the next couple of years. So it's important for us to understand what that means and what we can do. In addition to the board report, I added that section I just mentioned, but you have draft policies. If you recall, because Drew is a rock star, we have been reviewing the board policies when applicable. So you just voted on your bylaws today and approved them, right? So in the board report, you have two more. One is inclement weather and one there aren't any edits. The other is, oh, my bad, there are edits to inclement weather, opposite. The other one is board committee, and it's just how the committees are structured and how many committees you have. So if you could look them over now, so then that way when they do get added to the board agenda next month, you have a good idea about what those look like. Of course, Drew is here today and in the future if you have specific questions about the edits to the inclement weather policy. You could send them to me and we can look at them, but I would suggest that you guys discuss them. Like, in other words, if you have some potential, and just to be clear, it would be under Phil's direction, but if you give them, we can compile them, but then you as a group need to come to a consensus. Would that be accurate?
Yep, we would talk about them at program and budget for May. So if you have ideas, start thinking about them now, write them down, and send it to us ahead of time and bring them with you so we can talk about them.
Good, okay. Some other things to highlight is in front of you, you also have, we're just drawing your attention, it's a thicker little package. You already in the past approved the CCBHC contracts. Earlier you saw that Ken mentioned we have 3 new CCBHCs. You had previously approved the short-term agreement that we had with Easter Seals Mork. What's in front of you now is Judson. Judson has signed. We're only drawing your attention to it because we did have some minor edits. They were nothing substantial, but because we had those minor edits, we just wanted to share it again with you. But again, you already approved the generalized template that we used several months ago. We are still waiting on signatures from CNS and Easter Seals Mork. For the Easter Seals Mork one is the one that would start January 1st of 2025. CNS has stated they're moving forward and have taking it through their approval process. And then Easter Seals, we have one outstanding question, just to give you a generalized update of where we stand on that, which also potentially delays or cause additional glitches for what Ken was talking about, right? Like we have to financially execute, but we can't really pay until there's a fully executed agreement. Then in front of you, you have My Able. This would be in your also board report, but you have it in front of you now because the dates are coming up. So there is a in-person session or virtual for anybody who wants to learn about My Able. But next month, Lori Doyle, who was going to be here this month, and it's not her fault, it's our fault. She is actually going to present what is My Able, how people can benefit, and what we've been doing as a community. I am not the person that should speak on it, but I'll tell you in general. But if if I speak incorrectly, please correct me. Essentially, the My Able is an opportunity for somebody who might have a disability or might need to have a guardianship or some additional assistance and they have limited income. It's a way for them to save an amount of money in account because, as you know, in order to earn Social Security, disability, or any of those other assets, you can only have so much. So it's a way for them to have a set amount of money to save each year and kind of maximize that. But again, I am not doing it justice in any way. So we are going to have Lori come in and present and also share the printed materials. Also, the reason why you're getting this is we have the discussions with listed in this document. So if you want to hear the actual presentation from the My Able, which is associated with the state of Michigan, I would encourage you to do that. We're having a session for our own team, which includes you. But we're also having a session for the public, right? That our team could attend, but anyone in the public, if you haven't noticed, we've posted it on social media. And it's definitely an underutilized option for people with, in that particular setting. So I would encourage you to educate yourself. Let's see, drawing your attention to the state of Michigan settled, you guys have heard of the KD lawsuit, right? We've talked about that in the past. They've changed the name. I have no idea. It's different. It's now called the DD settlement. Essentially, I did do the attachment. So again, I'm not the attorney. I'm just doing a very high highlight, but you can definitely read through the materials that I shared. It was a class action formed where individuals were saying their children were not receiving the correct level of intensity of care. An example would be home-based services at the intensity of level my child needed. So that those group of individuals, along with disability rights, sued the state of Michigan and they won. And the settlement is actually kind of what the state of Michigan is promising to the individuals in order to get the state of Michigan at the level of home-based services and intensive services for children in need. There is no financial, because sometimes when you say class action, people think there's no financial gain for the humans. The only organization being paid is the disability rights organizations or the attorneys. I think it's 3.5 million. That's the only monetary item that's specifically identified in there. But if you do know somebody, again, I would read through the materials to understand. We, as an organization, prior to this, would have also stated to you that there is a limited or not enough intensive home-based services for children. That is a current challenge. But just to be clear, it is not due to the lack of effort. It is not due to the lack of anything other than there's only so many staff in our community that have the credentials in order to provide those services, right? So we will continue to strive, and we would have continued to strive long before this settlement came about, but just know it is a community-wide, and not just our community-wide, challenge. Other things is, in case you didn't know, because I'm just giving you a heads up, there is going to be another assessment. Hopefully Lori doesn't roll her eyes, but it's replacing the SIS.
Shaking the head and rolling the eyes.
Just as a heads up, so it's another tool. It will be another thing that the people we serve will have to go to, knowing that all assessments have a meaning and purpose and it's useful. But, we're trying to always advocate for, there's a balance somewhere in there, right? Where you have to do all these paperwork and answer 1,000 questions and to ensure your care is proper. But then there's also, right now our intakes take an hour and a half, right? And anybody who's been in the public sector, they don't have to take an hour and a half. So just know that we'll continue to advocate, and we understand that it's a good mission and purpose of why they're doing it, just to be clear. So we're supportive of that, but just know we also are trying to advocate, how can this potentially be implemented with the least amount of time needed for the people we serve, because ultimately that's who it prolongs, and of course, in addition to our staff. Let's see. Oh, I am going to try to end with two positives. So first, thank you to Lori and I, and along with Crossroads Clubhouse and Samantha and the crew from Crossroads Clubhouse did an amazing job. I was so proud of them. We had the opportunity to go to the coffee hour with Kevin Hertel last Friday, and Samantha and the crew stood up and talked about why this is important and why Medicaid cuts would negatively impact our community. Of course, they were very proud of Crossroads and they talked about the good stuff that we do there. Mr. Hertel or Senator Hertel, at least extended, he might be able to come out. So we're very excited to that, but we also want to continue to educate him and other legislators that there's lots of programs out there that they just don't know of. So we're going to try to make a diligent effort to talk to him about the things we're doing with law enforcement, talk to them about what happens at Crossroads. But I think there's a lack of, not just with him, to be fair, all of our community members about the plethora of things that we do on a daily basis in our community. So I just want to make sure Lori did a great job and she intervened, and I greatly appreciate her leadership in that. The last positive things is the most exciting thing. So every time I meet with people about the awards, Mental Health Matters Awards, it's my favorite meeting. There's no offense Drew, but there's no attorneys. There's no contracts, there's no, right? It's just about how can we celebrate our community. So as a reminder, as you know, it's May the 15th. Thank you for all the people who have all of you who have RSVP'd already. We had 152 because the nominations have closed now. We had 152 nominations. Yes, of those, there were 101 non-duplicative. So what I mean is we have one person who might have been nominated 2 times, 10 times, whatever that is. That is about what we got last year, just to give you kind of a comparison. The good thing about these this year, not that there weren't great ones, but these people have done an amazing job of painting the picture. Like I had the opportunity to do the discussions with the CEO earlier today, and I read one of our team members' ones that took up 2 slides, right, on a PowerPoint to read through. And at the end, this is what I said to people: if you don't get teary-eyed for that, you shouldn't work here. Because what an amazing, that particular submission was from a mom, and she was highlighting Darren O'Brien, who is a case manager in our children's department, and just the magnitude and impact of what he did and what that did for her son and what that did for her and how she was treated. So as you can see, I'm very, very excited, and that's just one of the ones that we have the privilege. I do want to thank, I know Donna's participating, Lori's participating, of reviewing in the nomination selection committee. So we should have some winners that will be a secret, but we will have some winners this Friday, and we'll slowly start reaching out to them. So I'm happy to answer any questions, but I wanted to end with a very, very positive topic.
Thanks, Tracy. Questions? Look at that. Excellent job. Everybody read the report. Everybody listened to the report.
Or they
Fantastic.
haven't yet, that's
Or
why.
they haven't yet. And if you haven't yet and you have questions, feel free to reach out. All right, we'll move on from the CEO update to other possible agenda items. A couple reminders. Program and budget for May already. It's going to be Wednesday, May 14th here at 6 p.m. And full board will be here Wednesday, May 28th at 6 p.m. And I want to personally, because I didn't get a chance to do this yet, welcome Sharita and Julia officially, even though you were 2 weeks ago. But yay, welcome. We're excited to have you. Are there any are there any board members that, Lori, go ahead. Thank you.
I believe I sent everybody an email, the nominating committee. We've had 3 people be nominated so far, that will be next month though.
Yes.
So if there's anybody else interested, it's for chair, vice chair, and secretary treasurer. If there's anyone else interested, please respond to my email thread, and next month we will hold our election.
Thanks for organizing that, Lori. That's okay. Yesterday I reached out to Sandy and I said, is that supposed to be on tomorrow's agenda? So that's where my head's at. Any other board members with any other comments? Okay. Now we'll move on to provider comments. Any providers wishing to give any updates? Okay. We'll We'll move on to the second and final hearing of the public. Anybody from the public? You've been waiting. I knew you were coming up. Come on, Jeff.
Yes, please come to the Mental Health Matters Awards. It is a lot of fun. Means a lot to staff to be able to mingle with you as well. Welcome. I also want to remind everybody, please put it on your calendar for the Health and Wellness Fair. We're putting on August 16th from 10 to 2 at the MISD. Thank you.
Thank you.
Yes.
Anybody else? Okay, we'll close the hearing of the public, and I will take a motion to adjourn. Motion from Megan, support from Nick. All in favor?